With DIO, you hear us talk a lot about the DDA kit and our DDA course. So I want to show you exactly what we're talking about, what is contained in a DDA kit. We're super excited to be working with Patterson Dental as one of our trusted distributors for DIO and the DIO Navi system. The DDA kit stands for the DIO Digital Academy, and the Digital Academy kits are specialized typodonts for you to practice on, where you can actually practice every type of the DIO Navi guided surgery. You can use those kits in a hands-on course where you go through that with a live instructor in person. We also have instruction that's available that walk you through each one of those cases and each one of those steps online so that you can follow along and place those implants at your convenience from any location.
Their courses teach you all the tools that you need to utilize the latest and greatest technologies in implant dentistry.
And it creates a system that becomes less complicated, something that you can take back to the office on Monday and implement right away and offer these solutions to patients that have been struggling for a long time with specific needs that I have not in the past been able to provide for them.
We have a special typodont that we'd use for what we call our standard cases, which is anything other than a full arch fixed case. And within that typodont, you can handle all kinds of treatment. The full arch typodont is also specialized specifically on practicing how to do full arch treatment and handling all the prosthetics associated. Let's take a closer look at those kits and we'll walk through each one of those and how that can help you learn how to place DIO implants at your own pace. We have DDA courses that are live courses where you can attend one of our courses regionally and you can go through this kit with a live instructor and follow along as they go through each one of these pieces. It's also available so that you can take this kit and follow through at your own pace, following the instructor step by step online and on-demand courses. So it's available in two formats. In either case, this is the kit that goes along with that learning course. This is what we call the DDA standard course, which is basically, this is going to teach us how to use DIO Navi for all kinds of placements other than fixed full arch all-on X treatment. We have a separate kit for that. But this will help us learn how to do everything else. So let's start by taking a look at the DIO Navi DDA model typodont. Now this is a very special typodont because it's designed to allow you to do, again, a variety of DIO Navi types of treatment on one model. And then the beauty is this is also a great model to use for your patient consultations. So you'll see when I open up the model, we have an edentulous arch, and we are going to perform an edentulous placement of implants. We have a few posterior locations where we can place a couple of posterior implants. One of those will be with the sinus lift. We have an anterior placements that will use a pre-made custom abutment and pre-made provisionals as well. So you can kind of get a variety of treatment all on this one typodont. Also in the box is all of the things you need to perform each one of these surgeries. They're really smartly packaged by case. So you'll see each one of these little baggies has a case number on it. So this case, this would be case number 3. There's going to be a case number 1, and so on and so forth. And each one of the cases corresponds to a different implant placement on your typodont. The standard case starts with very basically starting with a hands-on bone block. This is where you can place implants simply on a block of bone or a simulated block of bone, and so that you can understand the different offsets that we use when we talk about DIO Navi. So you'll understand how to use the different lengths of drills and the different offsets that correspond to your surgical kit. It's amazingly easy once you understand this. The cases then advance in difficulty and complexity. So case number 5 is going to be a single implant placement, and you'll see we have the surgical guide that goes along with it, the actual implant. Now these aren't actual titanium implants, of course, but they are actual exact size, shape, length, matching the DIO kit in an actual DIO implant container. And this kit also would come with a printed instruction sheet that will walk you through step by step. So you have the corresponding drilling protocols that match each one of these. So you're going to follow that step by step and place each individual case in each location on the typodont. Here's another, this would be our upper posterior with 2 implants at the same time. Here would be our anterior case, using narrow implants, custom abutments, pre-made provisional temporaries, and again the surgical guide that matches that case. We also have an edentulous arch where you learn how to fixate the guide using our special surgical kit when you're dealing with edentulous arches. If that's something that you want to do, you'll have the opportunity to practice that. Place all the corresponding implants that go along with it. And again, with immediate temporization for the arch. We also have, with each case, all the appropriate and necessary pieces that you need. So this container has the appropriate, either the healing abutments, custom abutments, or any other pieces that might be necessary that match, again, the surgical protocols that you get with this DDA kit. So as you can see, when we talk about the DDA kit, and this DDA standard kit specifically for this, you can see it's actually a very elaborate setup. Great consultation item to do patient consultations to show them about your procedures that you offer. Also, it allows you to firsthand experience all of the different types of surgery that you can do using DIO Navi. So by the time you're done, you should be comfortable with all the different types of things that you can do and ready to go ahead and perform that at the next level. All right, so let's take a look at the DDA full arch typodont so you can see what's provided in that kit. The typodont itself, you'll see, is actually very elaborate in the way that it's set up and the types of things that it allows you to do. And it matches exactly the protocol that you'll be receiving with your DIO Navi case in a box when you go to provide this treatment on a live patient. We're going to do everything with this DDA typodont that you would do on an initial surgery for a live patient, right down to the final pickup of the provisional bridge. Let's start by going through and looking at the model itself first. So you can see in this case, this is going to be a lower edentulous case, and we have the surgical guide that you would receive in your full arch case. In this case, it's going to be for an all-on-4, and we're going to see that that will fit exactly the typodont. We've also been provided a seating jig that actually fits into the guide. And the idea is that you would allow the patient to now bite down on the seating jig. That helps make sure that we have the surgical guide in the proper location and seating, especially when we're dealing with an edentulous arch. And as part of the practice with your DDA full arch typodont, you would then use our special kit or our fixed pin kit to go ahead and fixate this guide in place. So those are the different pieces there. Along with the typodont, now of course we have the matching implants. In this case, we've got two different size implants to match, again, the way that this surgical case was planned. And you'll receive this with the step-by-step drilling protocols that you'll follow along to place the implants using the surgical guide. Once your surgical guide is placed, we also have, just as you would receive in a case in a box, the temporary cylinders and cylinder protectors and multi-unit, multi-angled abutments. So in this case, we've got two multi-unit abutments and two multi-angled abutments. We would then go ahead and place your multi-unit abutments in the arch. You also have the temporary cylinders then that would detach to the top of your multi-unit abutments. I can promise that when you're doing this, it's going to amaze you how perfectly those multi-angle abutments and multi-unit abutments and the cylinders, once they're placed, line up. It's unreal. So we then have our provisional. In this case, this is a lower provisional, and you can see we have some holes that are pre-drilled through the provisional. This is the way that you would receive it. Now again, this is not a live patient case in a box. The real case in a box, the teeth are much more beautiful and are ready for the patient to walk out of the office with. These are the practice set. But you'll notice, in addition to the teeth, we have some extra flanges that help us make sure that we get the proper seating. So this would help me drop that over the top of the cylinders, do my pickup using my flowable resin that we've provided as part of the kit. You would then unscrew the temporary cylinders and remove the provisional, and at that point you could then remove these extra flanges of the teeth, and you'd be left, of course, with just the final teeth, ready for you to pretty those up and turn that into your final restoration. But as you can see, the beauty of the DDA full arch kit is that you get the opportunity to practice every step of that initial surgery all the way through finalizing the provisional temporary teeth that the patient's going to leave with. Again, the idea with this kit is to let you try everything that you're going to experience before having to do that on a live patient.
I took all the courses and began to expand my skills, and in doing that, I began to solve all the issues that I was having one by one, and the mist began to clear, and I began to be able to provide really good implant dentistry for my patients.
Their hands-on opportunities are fantastic as well, to really get used to and to get comfortable with some of the techniques that you're going to be doing.
It was now predictable and safe. It was now economically viable, It was now using great products and great systems and great workflows.
The end result is that you can feel confident and prepared in all of your DIO Navi surgeries.